Do you or someone that you know suffers from dementia or Alzheimer's? Today we're going to talk about dementia. We're going to talk about the diagnosis, the medical treatment, the prognosis. Stay tuned to the end as we will discuss the integrative and alternative therapies that help managing dementia. Dementia is a general term used to describe a decline in cognitive abilities severe enough to interfere with everyday life. It's not a disease itself, but a collection of symptoms that may be caused by various conditions. Understanding dementia, including its signs, diagnosis, treatments, and holistic therapies, can help individuals and caregivers take informed steps in managing the condition effectively. Early signs of dementia. Recognizing that the early signs of dementia is crucial for early diagnosis and intervention. While symptoms can vary, some common signs include memory loss, forgetting recently learned information, significant dates, or asking repetitively the same questions, having more difficulty in problem solving, struggling with planning and completing familiar tasks, such as managing finances or following recipes that you used to always do. They can have some language difficulties, trouble finding the right words and following conversations. Now, I'm going to say this too. In some of our older patients, it's not that they have dementia, but their hearing sucks and they need hearing aids. And a lot of times I'll have my patients come in and the family thinks they have dementia, and my assessment is that they need to get a hearing aid, and everyone's relieved. Disorientation, losing track of dates, seasons, or even your current location. You don't know where you are. Poor judgment, making decisions that don't align with one's usual character, such as neglecting personal hygiene. Changes in mood and personality. Someone that has heightened anxiety, they're confused or withdrawn from social activities. If you or a loved one experience these symptoms persistently, it's advisable to get evaluated. You want to do cognitive and neuropsychological testing. This is usually done with a psychologist. It's a neuropsych consult. They evaluate the memory, problem-solving skills, language skills, and other things that they check that psychologists do. MRIs or CTs. We usually order an MRI or a CT of the brain to see if there's a physical abnormality of the brain causing this memory issue. And that's when you get neurology involved if there's a deficit or abnormality in the brain. Blood tests, that can mimic dementia include vitamin deficiencies. You check a B12 level, check a thyroid level. I always check, because of neurosyphilis, I check syphilis, other symptoms that can mimic dementia. An early and accurate diagnosis can help in effective planning and treatment strategies. And also, this is amazing, or sad too. Patients that have low blood sugar, family members will often attribute that to dementia. And if their blood sugars are low, they're not eating. There is no cure for dementia, folks. Treatments for dementia. While there is no cure for dementia, various treatments can help manage its symptoms and improve quality of life. Medications that I'll prescribe are cholinesterase inhibitors, such as diazepam or the rivastigmine, which comes in a patch too. Memantine, that helps regulate glutamate activity in the brain to support cognitive function. A lot of times we try to give diazepam and memantine together, if it can get approved. Pharmacy doctors. Behavioral therapies, reducing agitation, anxiety, or depression related to dementia. You can try some lifestyle adjustments, encouraging regular exercise, a nutritious diet, and stimulating activities to support overall well-being. Lifestyle adjustments. encouraging regular exercise, a nutritious diet, and stimulating activities to support overall well-being. There are some holistic therapies that can help with dementia, such as art therapy. It encourages creative expression, improving the mood and communication. There's music therapy, which helps evoke memories and alleviate anxiety by playing familiar songs or melodies. And then there's aromatherapy, using essential oils, and I always go back to lavender, to promote relaxation and reduce agitation. It works, folks. The lavender does help you relax. Mindfulness and yoga, or Tai Chi, or any other practice that helps individuals with dementia feel calmer and more relaxed. I'm sure that there's an auricular acupuncture point on the ear somewhere, or acupressure point, that you can push on to help with your memory and cognition. And I'm sure that there's a neuro point that a acupuncturist can help to help with your cognitive health. So what we're going to do, folks, is we're going to go over to the auricular acupuncture points. And this print is so small. And we're going to go here. It's all alphabetical order. So D7, folks, is the brain. So D7. Right there, folks, that's where the brain is. You do an acupuncture point, acupressure point on the bottom of the ear, and that helps. Let's see if it's got something for memory. Yes, memory. D4. So you go to D. This is like playing Battleship, folks. D4. Right over there, memory. So there are auricular acupressure points that can be utilized. And I like to have this up just to go over it. So yes, folks, as we reviewed, there is auricular acupressure points that can be used to help with memory. What have you got to lose? You're pressing on your ear, or you're pressing on your loved one's ear. That's a pretty good intervention, huh, folks? You want to adopt a brain-healthy diet, okay? Like the Mediterranean diet. You can have a positive effect on your cognitive health. Eat healthy. You know, supporting loved ones with dementia, it's always tough. Living with dementia is challenging, not only for those that are diagnosed with it, but for their caregivers and family members. Here are some tips to provide effective support. Practice patience and understanding, okay? Remember that the behavior of the person is a result of the condition, not the person. Make sure the environment's safe. Remove potential hazards and implement safety strategies at home. Encourage cognitive engagement. Activities like solving puzzles, reading, or discussing familiar topics can stimulate mental facilities. Okay, and now this is the conversation that I have with patients, that they need to make their own decision, and family. They want me to write an order to say that the patient cannot drive anymore. Well, they can turn in their license. The family can turn in the license, and the patient won't have a driver's license anymore. They can get a state ID. It's up to the family to to take away the car keys. Okay, folks, you need to step up for your family, for your safety of your loved one. Don't ask me to do it. You want to build a network, okay? Join support groups for caregivers and share experiences and seek advice. Now we're going to talk about the naturopathics, and there's just a few for dementia. Of course, there's phosphatidylserine, and dementia affects millions of individuals across the globe, okay? Impairing memory, cognitive function, and the ability to carry out activities. Again, you know, there's not a definite cure. You can prescribe donazepam and momentine. But phosphatidylserine has garnered a significant attention for its potential benefits in dementia treatment. Now, this is phosphatidylserine. We're just going to call it PS from now on, okay? It's a word that's hard on the tongue. As you surmised, it's a naturally occurring phospholipid and a key building block of cell membranes, particularly in the brain, of course. It plays a crucial role in maintaining cell structure while facilitating communication between brain cells or neurons. Our bodies produce some of the PS on our own, but it is primarily from our diet, from foods like fish, soybeans, and white beans. Now I'm wondering, folks, do lima beans count as a white bean? Just something I can research. How do PS, phosphatidylserine, affect the brain? It's heavily concentrated in the human brain, where it supports some critical functions. It promotes neurotransmitter activity. Okay? It facilitates the production and activity of neurotransmitters such as dopamine and acetylcholine, which are vital for mood regulation, memory, and focus. It supports cellular communication. It helps maintain a healthy environment for the nerve cells, ensuring that they can send and receive signals. It reduces neural decline. Research indicates that PS may mitigate the loss of neuroplasticity, enabling the brain to adapt new information even as we age. Given PS's foundational role in brain health, it's no surprise that it's become a topic of interest in dementia treatment. Now, you're going to have some neurologists and some geriatricians outright dismiss phosphatidylserine. Okay? It's just, what have you got to lose, folks? Several studies suggest that supplementing with PS may deliver cognitive benefits, particularly those experiencing early onset dementia or Alzheimer's disease. Clinical trials have shown that PS may enhance short-term memory and recall, which are some of the first functions affected by dementia. Shows that it can boost cognitive function, okay? Evidence shows that PS may support problem-solving activities and mental clarity. It slows cognitive decline. Long-term supplementation has been proposed as a way to delay the progression of dementia by maintaining cell membrane integrity and promoting neuron survival. Now, while PS shows promise, it's essential to know that most studies suggest its benefits may be more pronounced in the early stages of cognitive decline. Much of the research has been conducted using PS derived from cows, now less common. Typical supplements now are plant-based. They're derived from soybeans or sunflower lectin. However, modern studies continue to point its potential efficacy. Try PS. Try the plant-derived PS supplements. The doses can range from 100 milligrams to 300 milligrams a day. Some side effects include gastro discomfort or insomnia, And the thing is, we always tell you to consult the healthcare professional, but if the healthcare professional knows nothing about naturopathic medicine, they're going to tell you that it's hogwash and not take it. Definitely know that PS is not a miracle cure. Its role in maintaining and improving cognitive function makes it an integrative part of dementia management. You know, I believe in the combined approach, including a balanced diet, physical activity, donazepam, memantine, and PS. It could offer some individuals more time. Okay. Now, the reality of this, folks, people that have dementia, it's not about if, it's about when. And you slowly see the decline of the cognitive function. And it's a sad thing to see, but it's also a part of life. And you can't dwell on what's current with that patient. You can't dwell that that patient doesn't remember his or her family member. Some family members get upset about that. Dwell on the memories you had growing up with that person. Dwell on the good times that you had with that person. And approach that person with those memories. A person is a person, folks. Our time is limited on this earth, and we go somewhere else.